Imagine having menstrual cramps so severe that you can't stand up, go to work, or even walk comfortably. Now imagine being told, it's just period pain, everyone goes through it. For millions of women around the world, this isn't imagination, it's reality. This condition is called endometriosis, and despite affecting nearly 1 in 10 women of reproductive age, doctors still don't know exactly what causes it. In many cases, it takes 7 to 10 years before a person is finally diagnosed. So, what exactly is endometriosis? Why is it so painful? Why is it so difficult to diagnose? And why has medicine struggled to solve this mystery? Let's find out. To understand endometriosis, we first need to understand the uterus. Inside the uterus is a special tissue called the endometrium. Every month, hormones make this lining thicker in preparation for pregnancy. If pregnancy doesn't occur, the lining breaks down and leaves the body during menstruation. But in endometriosis, tissue that behaves like the uterine lining starts growing outside the uterus. These growths are commonly found on the ovaries, fallopian tubes, the outer surface of the uterus, the bladder, the intestines, and the lining of the pelvis. In rare cases, similar tissue has even been found in the diaphragm and lungs. The important thing to remember is that this tissue still responds to monthly hormones. Every menstrual cycle, it thickens, breaks down, and bleeds, just like the lining inside the uterus. The problem is that, unlike menstrual blood inside the uterus, this blood has nowhere to go. It becomes trapped. This causes inflammation, swelling, scar tissue, and sometimes organs sticking together with fibrous bands called adhesions. This is why endometriosis can become extremely painful. The symptoms. Many people think endometriosis simply means painful periods, but the disease is much more complicated. Common symptoms include severe menstrual cramps, chronic pelvic pain, pain during or after sexual intercourse, pain while urinating or during bowel movements, heavy menstrual bleeding, bloating, fatigue, difficulty becoming pregnant. One surprising fact is the amount of pain doesn't always match the severity of the disease. Some women with extensive endometriosis experience very little pain. Meanwhile, others with only small lesions may suffer unbearable pain. Researchers still don't fully understand why this happens. Why does endometriosis happen? This is where things become fascinating. Despite decades of research, scientists still don't know the exact cause. Instead, several theories exist. Theory 1. Retrograde menstruation. The most widely accepted idea is called retrograde menstruation. Instead of all menstrual blood leaving the body, some flows backward through the fallopian tubes into the pelvic cavity. This blood may contain endometrial cells that attach to nearby organs and continue growing. But there's a problem. Around 80 to 90% of women experience some degree of retrograde menstruation. Yet, only about 10% develop endometriosis. Clearly, this theory cannot explain everything. Genetics. Endometriosis often runs in families. If your mother or sister has it, your risk is significantly higher. Scientists have discovered several genes linked to the disease. However, no single gene causes endometriosis by itself. Theory 3. Immune system problems. Normally, the immune system should recognize and remove misplaced cells. Some researchers believe that in endometriosis, this cleanup process doesn't work properly. As a result, these cells survive and continue growing. Theory 4. Cell transformation. Another theory suggests that cells lining the pelvis may transform into endometrial-like tissue under certain conditions. Scientists call this coelomic metaplasia. This theory may explain rare cases where endometriosis develops in unusual places. Theory 5. Stem cells. Some researchers believe stem cells from the uterus or bone marrow migrate through the body and develop into endometrial like tissue elsewhere. Evidence for this idea is growing, but it's still being studied. Today, most scientists believe endometriosis results from a combination of genetics, hormones, immune system differences, and environmental factors, not one single cause. Why is it so hard to diagnose? One of the biggest challenges is that many symptoms resemble other diseases. Patients are often misdiagnosed with irritable bowel syndrome, urinary tract infections, digestive disorders, and normal menstrual pain. Because painful periods have long been considered normal, many women wait years before seeking medical help or are not taken seriously when they do. The most reliable way to confirm endometriosis is through a minimally invasive surgery called laparoscopy, where doctors insert a tiny camera into the abdomen to directly view the lesions. While ultrasound and MRI scans can detect some forms of endometriosis, they cannot identify every case. Can it be treated? Unfortunately, there is currently no permanent cure. However, treatments can significantly improve symptoms. Doctors may recommend pain-relieving medicines, hormonal therapies that reduce estrogen levels, birth control pills, hormonal IUDs, surgery to remove endometriosis tissue while preserving fertility. For severe cases where pregnancy is no longer desired, hysterectomy may sometimes be considered, although it does not guarantee that all symptoms will disappear. Researchers continue working toward better treatments and hopefully one day a cure. Conclusion: endometriosis isn't just bad period pain. It's a chronic inflammatory disease that can affect education, careers, relationships, mental health, and fertility. Greater awareness means earlier diagnosis, better treatment, and improved quality of life for millions of people. And although science still hasn't uncovered its exact cause, each new discovery brings researchers one step closer to solving one of medicine's most complex mysteries. If you enjoyed this video, don't forget to like, subscribe, and share it with someone who might benefit from learning about this often misunderstood condition. Thanks for watching, and I'll see you in the next video. Ta-da!